A vast majority of the time, acupuncture does not hurt. So many patients think that we use needles. As a matter of fact, we don't. As acupuncture physicians, we use what we like to call instruments. There's a big difference between a needle or a hypodermic needle and an acupuncture instrument. If you were to look at a hypodermic needle under the microscope and zoom in on it, it's hollow and serrated and sharp. Why? Is because it needs to inject substance into the body. It has to cut and has to tear. With an acupuncture instrument, if you were to look at it under a microscope, it'd be like the tip of your pinky, blunt and solid. So when an acupuncture instrument penetrates the skin, it moves the nerve endings left and right, and patients most of the time don't even feel anything at all. Many of the times when patients do feel something, they say it's like a little mosquito bite, or maybe even a little pinch at the worst. But a vast majority of the time, it doesn't even hurt. As a matter of fact, you can fit about 12 to 15 acupuncture instruments inside the standard hypodermic needle. This is an acupuncture instrument. It's single, one-time use, and disposable. An acupuncture instrument consists of two parts: the handle and the instrument that we use that actually penetrates the skin. And like I said earlier, a vast majority of the time, it doesn't even hurt. It's super, super thin. It's the size of a cat's whisker or two hairs. When it penetrates the skin, the tip is blunt. So what happens is the nerve endings move left and right, and I'd say 9 out of 10 times, or even 99 out of 100 times, it doesn't even draw blood. It's very bendable. And we treat kids from the ages of 2 to 102. And the pediatric patients that we treat sit there and they play on their iPad, and mostly all the patients love the feeling of getting acupuncture.